स्वस्ति नः पूषा विश्ववेदाः स्वस्ति नस्तारक्षो अरिष्टनेमिः स्वस्ति नो बृहस्पतिर्दधातु बृहस्पतिर्मरुतः प्रश्नेमातरः शुभज्ञावानो विदते सुजग्भयः अग्निर्जिह्वा मनवः सूरचक्षुषो विश्वेन्द्रो देवा अवसागमानेह भद्रं कर्णेभिः शृणुयाम देवा भद्रं पश्येमाक्षमिभजत्राः स्थिरैरङ्गैस्तुस्तवागुणसर्गैर्दर्शं तनो नाम पुत्रासु यत्र पितरो भवन्ति मनो मध्यारिसिंहाजुगन्तो अदितिः दौरदितिरन्तरिक्षमदितिर्माता स पिता ब्रह्मादिज्योतिः दीपार्तो मे पापं साक्षदीपं नमस्तुते शुभं करोतु कल्याणम् आरोग्यं सुखसम्पदं शत्रुवदे विनाशं च दीपज्योतिर्नमोस्तुते दीप्तभ्यो नमः महनीयमेधावीं त्वदीयं स्वागतं कुर्वम् सर्वश्रेष्ठ जनानां स्वागतम् अस्मिन् कार्यक्रमे अन्तर्गते महामहनीयमेधावीं दीनो नो धन्यतामेतद् त्वदीयं स्वागतं कुर्वम्। आप सभी का स्वागत इस कार्यक्रम में। इसी के साथ मैं आमंत्रित करूंगा कार्यक्रम को आगे बढ़ाया जाए।
So now let us honor our chief guest, is none other than Dr. Ashok Kumar Vashak. So the honors is done by none other than DD HMRF INT Professor Dr. Deepak Raut sir. So now let's do the honors for Dr. Anand Biradar sir, member of Naturopathy Registration Board, Ministry of Ayush, Government of India. So can you all put hands together for him? Thank you so much for being here in this busy schedule. So he's been guiding us each and every. Welcome to you, sir. Thank you for being here in this busy schedule. So next, let us honor Dr. V.K. Katiyar, Dean Academics of Research, University of Bagaram Hospital, Delhi. Thank you for being here, ma'am. And let's put hands together for Dr. Kanak. Bio Healing Arts. So now let's honor Mr. Chetan Sharma as the Editor-in-Chief, Metro Mat News. Thank you for being here.
To all, it's a nice pleasure to meet you all once again after the Second World Congress. It's a great pleasure to be here to unite each other to promote the one concept, one world, and which is the basic of WHO mission, strategy of traditional medicines. So first of all, I heartily congratulate to all the executive team and my gratitude to all the international speakers from 10 countries and all the guest speakers and all the eminence here. It will be always mesmerized to promote amongst all the eminent people. Dr. Ram Adhar Yadav, who is our chief guest, the Executive Director, Health Ministry, Nepal, and which was recommended by our eminent Dr. Biswarup Roy Chaudhary. No words for the Dr. Biswarup Chaudhary. Invisible, he helped lot to success this Congress. I thank you, Dr. Biswarup Chaudhary. Definitely, I think many of you, somebody came for only to gain the knowledge. Somebody came here to only to gain the awards. Am I right? But you will get anything. But please listen carefully to our old speaker. They did very hard work. They are coming here to promote, to support the traditional medicines. And this is a very emotional touch to all, and I can say the two men behind this Delhi program, Dr. Umakant Sharma, Dr. Vivek Gupta, two are the most iconic for this Delhi program, to run day and night. Otherwise it could not be successful today, because as I am residing in Hyderabad, so I need support of all the state people. So first of all, Holistic Medicine Research Foundation mission is to promote the traditional medicine throughout the globe, and we have already enriched with 11 countries and promoted the same concept in each and every country. And our mission is not only Hyderabad, because Hyderabad we have started this concept in 2018, and there I think many of our old member, Anand Biradar is also there. He is the eyewitness how we started with the 2018 Congress. So during the Corona call, we could not make it because 2 years we could not, but our journey is also continued. And I must say, there are a lot of history in traditional medicines. We are not specific for any of the science. We are promoting the entirely traditional medicines, whether it is ice system or non-ice system. Because integrated system is the most important here, and we have a very good lecture with the first time with the history group panel doctor with the all eminent doctors, and there is the integrative medicines versus the multi-therapy concept. You will get it today. So first of all, I thank you all the eminent sitting here in dais, because we are so much of delayed. I have to conclude my speech actually, so I am not taking one by one name. So please take to my other ear.
ट्रेडिशनल मेडिसिन के लिए थर्ड वर्ल्ड कांग्रेस है। ब्यूफुल में हिंदी मैं पूरे देश में हेल्थ के पॉजिटिव प्रमोशन इस विषय को लेकर आरोग्य भारती के नाम से काम करता हूं। आरोग्य भारती की एक मान्यता है कि जितनी भी थेरेपीज हैं, चिकित्सा पद्धतियां हैं, सभी की अपनी अपनी विशेषताएं हैं, स्पेसिफिसिटीज है, और जहां उनकी स्पेसिफिसिटीज है वहां उनकी लिमिटेशंस भी है। लेकिन इन सभी पद्धतियों की एक विशेषता है कि वे सभी एक दूसरे के लिए कॉम्प्लीमेंट्री है, कॉम्पिटिटिव नहीं है। और दूसरा विषय जो इसके साथ जुड़ता है कि सभी पद्धतियों की विशेषता होने के कारण सभी अपने अपने स्थान पर पुष्पित पल्लवित हो रही है, फ्लरिश हो रही है, समाज को उनका लाभ भी मिल रहा है। लेकिन इनके साथ और एक चीज जुड़ी है, केवल ट्रीटमेंट वाला पार्ट ही नहीं, तो प्रिवेंटिव एस्पेक्ट भी इन पद्धतियों का एक महत्वपूर्ण भाग है। और अपने में से दूसरी पद्धतियां ऐसी भी हैं कि जो चिकित्सा करती है लेकिन ड्रगलेस थेरेपी है, उनमें ओरली कोई ड्रग नहीं दी जाती। मैं कई बार सोचता हूं पिछले दिनों एक घटना हुई, मैं वही बता देता हूँ। मॉडर्न मेडिसिन के फील्ड में एक संगठन काम करता है, नेशनल मेडिकल ऑर्गेनाइजेशन। उनकी नेशनल एग्जीक्यूटिव कमेटी की मीटिंग चल रही थी। आयुष मंत्रालय ने कुछ समय पहले सर्जरी के लिए कुछ गजट नोटिफिकेशन निकाला था। तो मॉडर्न मेडिसिन के जो डॉक्टर एनईसी में थे वो चर्चा कर रहे थे कि हम तो पढ़ते हैं और बाकी लोग पढ़ते नहीं, वो सर्जरी कैसे करेंगे। तो वहाँ बैठे हुए उनके भी सीनियर्स, उन्होंने भी कहा अच्छा ये बताइए कि आपकी मॉडर्न मेडिसिन कितने वर्ष पुरानी है? 100, 200, 250 और भी कुछ जोड़ लीजिए। होम्योपैथी कितनी पुरानी है? तो और थोड़ी सी 250 वर्ष होगी। आयुर्वेद बहुत पुरानी है। तो जिस समय लोग बीमार पड़ते थे उस समय तो फिर ठीक नहीं होते थे क्या? होते थे। और एक पहलू है, पहले इतने डॉक्टर्स हॉस्पिटल थे क्या? तो शायद नहीं थे। तो भी लोगों का ट्रीटमेंट होता था। कैसे होता था कि व्यक्ति स्वयं प्रयास करता था। शरीर की जो इम्यूनिटी है, बॉडी की इम्यूनिटी है, पहले वही काम करती है और उसके बाद व्यक्ति अपने आसपास देखता है कि उसके आसपास क्या चीज उपलब्ध है। भारतीय परिवारों की एक विशेषता है कि हर एक के किचन में कुछ मसाले हैं। हम में से जो पूरे विश्व भर में घूमते होंगे उनको मालूम होगा कि मसाले सब जगह नहीं मिलते। ये भारत ही है जो प्राचीन काल से लेके आज तक मसालों का व्यापार करता आया है। भारत से ही बाहर जाते हैं और वे हम में से जो जानकार हैं उनको मालूम होगा कि मसाले ही बहुत सारी औषधियाँ हैं और हम सहज रीति में उनका उपयोग भी करते हैं। तो वे मसाले हमारे भोजन में स्वाद बढ़ाने के लिए नहीं है, स्वास्थ्यवर्धक है। और इसलिए छोटी सी चीज अभी कोरोना में सबने पूरे विश्व ने देख लिया कि ट्रेडिशनल मेडिसिन सिस्टम तो वर्ल्ड के बहुत सारे देशों ने प्रयोग किया। चाइना, स्विट्जरलैंड, इंग्लैंड, अमेरिका, ब्राजील, मलेशिया, इंडोनेशिया, ताइवान, भारत ने भी किया। और भारत के आयुष मंत्रालय ने, हेल्थ मिनिस्ट्री ने जो छोटे छोटे प्रिवेंटिव एस्पेक्ट्स की एडवाइजरी जारी की थी, उसका परिणाम था, छोटे छोटे तो थे, हाथ धोना, मास्क लगाना, घर में उपलब्ध वस्तुओं से काढ़ा बनाना, गर्म पानी पीना, ताजा भोजन करना, ऐसी सारी चीजें थी। नाक में 2 बूंद अड़ू तेल डालना, सबने उसका पालन किया तो ठीक रहे। भारत की तुलना में 40%, 50% पॉपुलेशन वाले देश, वहां पर उस समय भी कोरोना के एक्टिव केसेस ज्यादा थे, मॉर्टेलिटी रेट भी ज्यादा था। आज भी जब कोरोना समाप्त प्राय है तो भी एक्टिव केसेस उन कंट्रीज में जिनकी पॉपुलेशन 40-50% है भारत की तुलना में, आज भी ज़्यादा है, मॉर्टेलिटी रेट आज ज़्यादा है। क्यों? भारत में स्वाभाविक रूप से इस तरह के मेडिसिन सिस्टम्स को सहज रीति में पालन करने का अभ्यास है। और इसीलिए जिस समय आयुष काढ़े की चर्चा हो रही थी, उन दिनों में केवल भारत के लोग इसका प्रयोग नहीं करते थे। मैं बहुत सारे इंटरनेशनल वेबिनार्स में जुड़ा करता था तो सुनता था कि अमेरिका में 65% पॉपुलेशन आयुष काढ़े का प्रयोग कर रही थी। बाद में मैंने पढ़ा एशिया और यूरोप के देशों में 80% पॉपुलेशन आयुष काढ़े का प्रयोग कर रही थी। और भारत सरकार के आयुष मंत्रालय ने संजीवनी ऐप के माध्यम से कैलकुलेट किया कि 89% पॉपुलेशन आयुष काढ़े का प्रयोग कर रही थी। मैं पूरे देश में घूमता हूँ, रोजाना लगभग ऐसी एक गैदरिंग मिलती है मुझे।
वार्ष्णेय जी, बहुत बहुत धन्यवाद। आपने बहुत ही सुचारू रूप से समझाया कि कैसे हमारे मसाले जो हैं हम भी प्रयोग करते हैं। मैं गंगाराम हॉस्पिटल में प्रिवेंटिव हेल्थ एंड वेलनेस की डायरेक्टर हूँ। तो मैं अपने पेशेंट्स को ये कहती हूँ कि भाई वापस नहीं आना है तुमको, तो ये चीज़ें यूज़ करना है। तो वो लोग कहते हैं भाई घोड़ा घास से दोस्ती करेगा तो खाएगा क्या, बट मेरे लिए बहुत इंपॉर्टेंट है उनका ठीक होना, वापस नहीं आना है उनको। वेरी इंपॉर्टेंट। विवेक गुप्ता जी का बहुत बहुत धन्यवाद, उन्होंने मुझे यहाँ पे आमंत्रित किया। डॉक्टर लोहिया सर नमस्कार। हम बहुत आपके आभारी हैं कि आपने हमें इस तरफ मोड़ा, बिकॉज ट्रेडिशनल मेडिसिन इज द बेस्ट, बिकॉज हमारे इंडिया में अभी जहाँ पर जो कहते हैं ना कि रोटी कपड़ा और मकान, उसके ऊपर आदमी उठ ही नहीं सकता, उसके ऊपर ट्रेडिशनल मेडिसिन इतनी इम्पॉर्टेंट है कि वो ड्रगलेस है, लेस एक्सपेंसिव है और सब लोग इसका इस्तेमाल कर सकते हैं, अपने घर में ही कर सकते हैं, मसालों के द्वारा, तेल के द्वारा, एक्यूप्रेशर के द्वारा। क्यों सर, मानेंगे नहीं मानेंगे? और स्पेसिफिकली जो है वो प्रॉब्लम की अंत हो जाती है। इन आवर सिस्टम, इन एलोपैथिक सिस्टम में क्या है कि हम सिम्टम तो क्योर कर देते हैं, सिम्टोमेटिक ट्रीटमेंट अपार्ट फ्रॉम एंटीबायोटिक्स वी डोंट क्योर द डिजीज अनफॉर्चुनेटली। बट यहाँ पर आपका जो बेसिक प्रॉब्लम है, बेसिक जो अंदरूनी प्रॉब्लम है, उसको हम निकाल के बाहर फेंक देते हैं, एंड दैट इज द मोस्ट इम्पॉर्टेंट थिंग। वी शुड एक्चुअली ऑल वर्क हार्ड टुवर्ड्स दिस, क्योंकि ये हमारा बहुत पुराना सिस्टम है। सुश्रुता, हमारे चरक, हमारे पतंजलि, हमारे जितने भी पुराने योगी मुनि हैं, उनकी सबकी उम्र 100 साल हुई है। क्या खाके हुई है? All these Ayurvedic herbs, yoga, meditation. So हम इतने ज़्यादा रिच हैं, हमारी कंट्री इतनी ज़्यादा रिच है, और ये हमें दूसरे लोगों को बताना है, भारत को विश्व गुरु बनाना है। प्रधानमंत्री जी के थैंक यू। अपनी बॉडी ही इम्यून है, आपकी बॉडी ही आपको रिपेयर करेगी, और हमेशा याद रखें, प्रिवेंशन इज बेटर देन क्योर। जान है तो जहान है। You all agree with this? And food is very important. न्यूट्रिशनिस्ट साहब बैठे हुए यहाँ पे हमारे सामने, विष्णु चौधरी जी। ये
Anand Biradhar is member of Naturopathy Registration Board, Ministry of Ayush, Government of India. So can you all...
गुड मॉर्निंग एवरीबॉडी। आज वर्ल्ड कांग्रेस ऑन ट्रेडिशनल मेडिसिन का ये तीसरा कार्यक्रम है, और सौभाग्य से मैं सभी कार्यक्रम में भाग लिया हूं, चाहे वो हैदराबाद हो, चाहे बेंगलोर हो, और इसके पूर्व भी डॉक्टर दीपक राउत जी बहुत सालों से इंटरनेशनल नेचुरोपैथी ऑर्गेनाइजेशन INO के साथ जुड़े हैं, और डॉक्टर राउत जी और उनकी टीम, सागर जी भी मुझे दिख रहे हैं, तो पूरे हैदराबाद में ये रहने वाले वो उड़ीसा के हैं, और हैदराबाद में बसकर इतना बड़े लेवल पर ट्रेडिशनल मेडिसिन के ऊपर काम करना और एक संकल्प के साथ निरंतर काम करना, तो मैं आज इस तीसरे वर्ल्ड कांग्रेस आयोजन के लिए डॉक्टर राउत जी और उनकी पूरी टीम को बहुत बहुत स्वागत और अभिनंदन करना चाहता हूँ। वो करते आए हैं, हम आपका हार्दिक स्वागत और अभिनंदन करते हैं। अशोक सर ने ये बताया, दूसरों की कॉम्प्लीमेंट्री बनना चाहिए, कंपटीशन नहीं होना चाहिए। एक छोटी सी बात बता दिए, लेकिन कितने लोगों ने उसको ध्यान दिया, नहीं दिया, मुझे नहीं पता। आज के डेट में हमें एक दूसरे का कॉम्प्लीमेंट्री बनकर काम करने की आवश्यकता है। और आज मैं एक छोटी सी बात कहते हुए, क्योंकि मन संचालक बगल में पास आ रहे, तो मुझे शॉर्ट में करना पड़ेगा। मुझे एक बात ध्यान में आती है, देखो कई बात ये सभी यहाँ जितने भी लोग हैं, मुझे नहीं लगता नहीं फॉर्मली कोई ट्रेडिशनल मेडिसिन का शिक्षा लिया हो, लेकिन आज वही व्यक्ति ट्रेडिशनल मेडिसिन में सबसे बढ़िया और देश के सामने एक रोल मॉडल रखने का काम आज हमारे साथ बैठे हुए सभी लोग कर रहे हैं। भारत स्वतंत्र होने के पहले एक गुजरात के व्यक्ति ने सपना देखा कि ड्रगलेस थेरेपी, आज मैं उसको ड्रगलेस थेरेपी बोल रहा हूं, ये ड्रगलेस थेरेपी का ज्ञान घर घर तक पहुंचना चाहिए और ड्रगलेस थेरेपी का एक यूनिवर्सिटी बनना चाहिए। और भारत स्वतंत्र होने के पहले ये सपना देखा और उस समय एक संस्था बनाई और वो काम और उसका उद्देश्य था एक यूनिवर्सिटी बने और इसका ज्ञान घर घर तक पहुंचे। वो 75 साल तक भारत स्वतंत्र होने के पहले सपना देखा और स्वतंत्र होने के बाद भी वो भारत आजाद होने के बाद भी सपना साकार नहीं हुआ। उस सपने को साकार किया दूसरा एक गुजरात का व्यक्ति भारत स्वतंत्र होने के बाद। जो सपना उस व्यक्ति ने देखा था और वो सपना साकार किया, भारत के यशस्वी प्रधानमंत्री नरेंद्र भाई मोदी जी ने इंडिपेंडेंट आयुष मंत्रालय बनाया और ग्लोबल सेंटर फॉर ट्रेडिशनल मेडिसिन, जिस उद्देश्य को लेकर हम यहां पर बैठे हैं, हमारा सभी का उद्देश्य एक ही है। वो गुजरात को उस व्यक्ति ने, महात्मा गांधी ने सपना देखा और उस सपने को साकार नरेंद्र भाई मोदी गुजरात के दूसरे व्यक्ति ने किया। तो मुझे आज ऐसा लग रहा है कि ये ओडिशा से आए हैं और हैदराबाद में काम कर रहे हैं ट्रेडिशनल मेडिसिन के लिए, और सपना तो बहुत देख रहे हैं। और इस सपने को साकार करने के लिए देखो, आजादी के 75 वर्ष तो हो गए, अभी अमृत काल चल रहा है। विश्वरूप चौधरी साहब, ये अमृत काल में मुझे लगता है कुछ ना कुछ बड़ा धमाका होने वाला है। इसीलिए ग्लोबल सेंटर फॉर ट्रेडिशनल मेडिसिन हो, आयुष मंत्रालय हो, उसमें अलग अलग प्रकार के पॉलिसी हो, या अलग अलग राज्यों में योग आयोग बनना हो, नेचुरोपैथी आयोग बनना हो, पता नहीं कुछ ना कुछ हो रहा है और कुछ ना कुछ होने की उम्मीद है और अपेक्षा है। इसीलिए हम सभी को एक काम करना है। जैसा अंगूर का गुच्छा होता है ना, अंगूर का गुच्छा बड़ा एक साथ रहता है तो उसकी कीमत बहुत होती है, अगर वो खुले में बिकता है तो उसकी कीमत बहुत कम होती है। उस गुच्छे के अंदर छोटा अंगूर भी बहुत मीठा होता है, कभी 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 अच्छा दिखने वाला अंगूर भी काम का नहीं होता, देखने में तो अच्छा होता है। तो हम एक साथ, जैसा माननीय चीफ गेस्ट ने ये बात बोली कि हम सभी को कॉम्प्लीमेंट्री बनकर काम करना है, क्योंकि कई बार हम ट्रेडिशनल मेडिसिन करते हैं तो दूसरे को गाली देते हैं या दूसरे सिस्टम की कमी बात करते हैं। हमें बिल्कुल कभी नहीं करना चाहिए। जिस प्रकार का अंगूर का गुच्छा है, उसी प्रकार से अगर हम रहते हुए आगे बढ़ेंगे, तब आपकी बात सरकार भी सुनेगी। सरकार के ऊपर भी अगर कोई है, ऊपर भगवान है, वो भी जरूर सुनेगा। तो आज समय हम सबको एकत्रित होकर ये इस सिस्टम को आगे बढ़ाने की आवश्यकता है। और आज के मुख्य अतिथि डॉक्टर अशोक वार्ष्णेय जी आयुष मंत्रालय के मेंबर तो है ही है, और मैं प्रार्थना करता हूं कि भगवान से कि ट्रेडिशनल मेडिसिन का जो भी कमेटी बनेगा, उसमें ऐसे अशोक वार्ष्णेय जैसे व्यक्ति रहना चाहिए, ताकि वो सभी के लिए न्याय दे सके। ये कभी भी हमेशा आपके साथ है, कभी सहयोग ज्यादा होता है, कभी कम होता है, लेकिन प्लानिंग अगर पहले से होती है तो हम बहुत अच्छे से इसको और कर सकते हैं। और मैं अशोक वार्ष्णेय सर के सामने एक निवेदन करना चाहता हूँ। एक निवेदन ये करना चाहता हूँ कि समालका सोनीपत में एक बहुत बड़ा केंद्र बना है, बहुत बड़ा कैंपस बना है। विश्वरूप चौधरी जी कल बाल गंगाधर तिलक जी जयंती के उपलक्ष्य में एक बहुत बड़ा धमाका करने वाले हैं। यानी देश को एक जागृत करने का उनके पास एक यूनिक टेक्निक आइडिया होता है। ऐसे ही मैं उसी हिसाब से हम सब मिलकर, उसमें हम केवल नेचुरोपैथी आयुर्वेद वाला आयुर्वेदा ये बोलने का कोई फायदा नहीं। आयुर्वेद भी अच्छा है, योग भी अच्छा है, नेचुरोपैथी भी अच्छा है। हम सब मिलकर एक, अभी मैं नेचुरोपैथी योग के लिए भाई साहब प्लानिंग किया हूँ, सितंबर या अक्टूबर 2 तारीख को भी कर सकते हैं। एक 3 दिन का प्रोग्राम ऐसा करे, वहां पर लगभग 3000 लोगों को रुकने की भी व्यवस्था है, और ग्राउंड है, हॉल है बड़े बड़े, और वहां पर ऐसा हम कर सकते हैं। इस दिशा में आप हम सबका सहयोग करें। और इस कार्यक्रम में आईएनओ के भी कई लोग आए हैं, और ट्रेडिशनल मेडिसिन के एक्यूप्रेशर, एक्यूपेंचर, ये सभी बहुत से स्टूडेंट, एक गुप्ता मैडम भी आए हैं, बहुत से लोग हमारे आईएनओ के भी आए। आप सभी का स्वागत करते हुए मैं यहाँ पर अपनी वाणी को विराम देता हूँ।
And my dear friends, it's a great pleasure to be here, and we should talk about the integrated medicine. That is what has been told till now by the previous speaker, by Dr. Anand Giradharji, by Ashok ji. We should collaborate the good qualities of all the therapies. So with this idea, 2 years back, me and my friend and partner Achar Manishji sitting here, we started what we call as HIMSS, that is Hospital and Institute of Integrated Medical Sciences. So right now we are having 21 branches, 21 hospitals in India. In India it is 20 and one hospital in Malaysia. So if you come to our hospital, you will see the true picture of integrated medicine. You will find allopathic doctor, Ayurvedic doctor, homeopathic doctor, naturopathy doctor, all of them together. Patient-centric treatment. When the patient comes, he is not a patient of allopathic doctor, he is not a patient of Ayurvedic doctor, he is a patient. Patient-centric. So how we treat the patient, that's what I am going to show today. And is screen bhi hai kya? PPT. So that's what I am going to show today. And the topic right now you are having in your hand the book called The Rabbit Tortoise Model for Cancer Cure. And I'll just take, these are the 4 rules. If you understand these 4 rules, you will understand that any kind of cancer at any point of time is treatable and curable. And those who don't believe this, for them, today in newspaper, we have given a full page ad. Acharya Manish has given a full page ad in the major newspaper of Delhi, Hindustan, Amar Ujala, and Jagran, where we have said that you come tomorrow, that is 23rd of July, Chandrasekhar Azad Jayanti, Bal Gangadhar Jayanti, and you will find the patients who use the same method which you are going to learn in next 10 minutes. So straight away come to the point. When we say cancer, so we have to understand in our body there is the rule number 1. There is one kind of cancer in your body, in all of our body, that is called indolent cancer cells. So this photo is there in the first inner page of the book which you are having right now in your hand. The inner page of the book you are having right now, you will find that photo. Are having cancer cells, and I give you the percentage wise, but they are called indolent cancer cell. It can be compared with the tortoise. As if a tortoise is right there, but the tortoise is not going to disturb us, not going to disturb this lecture. It will sit, it will sleep, but it is right there. Similarly, the indolent cancer cell which is there with all our body, but it is in detectable amount. The problem is that if, fortunately or unfortunately, we go for biopsy, it will say, yes, your body is having cancer. The second rule is, the biopsy cannot distinguish between the cancer cell which can harm and the cancer cell which cannot harm. There are about 5% of us who are having a cancer cell which can harm. I call it, those are called the cancer cell which are aggressive cancer cell. I call it rabbit type cancer cell. Imagine a rabbit inside the hall. What will happen? The rabbit will not allow us to proceed to the seminar. What will happen? The rabbit will jump from one place to other place and will make the whole thing dirty, right? Create a chaos. So that kind of aggressive kind of cancer cells, if they are present in our body, they are the one which can kill us, right? They are the one which will cause tumor, they are the one which will cause pain, they are the one which will lower your hemoglobin level, it will give you weakness and it will give you the real sickness. But the problem is, through biopsy, only the doctor will tell you have a cancer cell, but whether it is a tortoise kind of cancer cell, which will not kill you, or whether it is a rabbit kind of cancer cell, that science has not yet established. Here, the important thing we have to understand about biopsy, which is known to be the gold standard of diagnosis. That means if the biopsy says cancer, this means at the end of your life. That is what is the perception of all of us, including doctors, XYZ, everybody, including the pathologists themselves. Very interesting thing you have to understand. Very, very interesting thing. You have to understand that how much we should believe in the biopsy results. For that, a trial or study was done. And in the study, this is a biopsy slide. The same biopsy slide I'm talking about. In how we develop a biopsy slide, from the suspected part of the body, a small part, small tissue is taken, and it is put in a converted into slide, and that slide is being observed by the experienced pathologist, and pathologist by looking at the slide. Remember, looking at the slide, the pathologist decide whether it is a cancer or not. Now this slide which you are watching on the screen, this slide is there in your book also, the book which is there in your hand. This slide was given to 800 pathologists, those who are not connected to each other, and it was asked, tell whether it is a cancer or not. 19% of the pathologists says this is a normal cell. 38% of them said it is an abnormal cell, and rest of them said it is cancer. So this means whether you are a cancer patient or not, it depends on to which pathologist you have gone. It is not depend on your body, anything else, right? Just you change your pathologist, you will change your result, right? So you cannot depend on the biopsy report. And also, if all the pathologists say it is cancer, they cannot say whether it is a rabbit kind of or whether it is a tortoise kind of. That is one disadvantage of biopsy. Besides that, it is very painful, we know. It is an extremely painful thing. For 84% of the people say it is very, very painful. It causes death, it causes injury, it causes permanent injury. All these things with the reference of the medical journal is there in your book. The pain threshold is for most of the people up to the 9 or 8. That is extremely painful process. So you are going through an extremely painful process which is not reliable at all. So, and I am talking about the gold standard. The gold standard, that is the biopsy, nothing beyond that. I am not talking of mammogram, etc. Right? So this we have to understand. Now, if we talk of the basic mammogram, I'll take only 10 minutes more, right? So if we talk of the basic mammogram, it is being told that after 40 you have to go for mammogram every year, so as a preventive, so that if there is some cancer inside, you will get it early and you will be saved, we can stop that there. That is how the story goes. But important is we have to understand what happens when you go for a mammogram, what it is. Mammogram is simply, if you see, so what you see in the mammogram, your video hai, if you are listening, controller. So in the mammogram there are two plates, and two plates it comes together, right? Press the breast to the extent that it should be too painful to the patient. The healthy cell inside the breast that breaks and it causes internal injury. Internal injury, that is a wound. We have to understand the mechanism of wound healing and the mechanism of cancer is same. The wound healing process, it does not stop, that is called cancer. What is cancer? By definition, if the wound healing process does not stop, that calls cancer. So here to make you understand, you can do one experiment to make you take on my head of course, hand mic. So say a fruit, I put it and try to press it as much as I can, and after that 2 days what will happen? When you smell, it will be bad smell, it is already spoiled. Whereas the other one, it will be intact. So the same thing happens to the breast. You are creating cancer. You have to understand that. You are creating cancer. You are injuring your cells inside, and that is too painful, you know. And that injury, the body try to heal, and when the wound starts healing, and if that healing process does not stop, that becomes cancer. Right? So mammogram, in the name of mammogram, people are creating cancer. Mammogram cannot detect cancer, it can create cancer. That's one thing you have to understand. If you stop going for mammogram, so automatically the number of, at least the healthy people converted into cancer, that becomes lesser. Right? Now they come to us running, right, and showing that I am a 4th stage cancer patient. The stage word, how it came only about 20 years back. 3rd stage patient, 4th stage patient, how it is? I said radioactive material injected in the body. Anybody with a very little knowledge must know the radioactive material that causes cancer. So here the patient or the healthy person is going with the intention to detect the cancer, but actually he is trying to feed cancer because he is feeding the radioactive material inside his body. You have to understand this. You must be knowing those who go for PET scan, they are told by the doctor themselves, they don't come close to the pregnant woman or small children for 1 week because in your body there is a radioactive material, it may cause cancer to the pregnant woman or the small children. Just imagine, by just going near to the people can cause cancer to those people because in your body radioactive material is traveling, will it not cause cancer to you? No, it is stage 3, stage 4. You see, wherever there are more shining, those are known to be cancer as they tell it. But shining only shows that the place which cells which eat more glucose, in those cells there will be more radioactive material found and they will shine. So eating more glucose do not translate into cancer automatically. You have to understand that. So PET scan cannot detect cancer. It can only detect which are the cells which eats more glucose. Right? Eating more glucose does not necessarily mean cancer, or those cells who do not eat more glucose does not mean it is cancer free. So they look very healthy, absolutely healthy. They are actually healthy. Only in paper they are cancer patients. So here the third rule and the fourth rule. So the rule here is, healthy person can get converted to cancer patient. Chemotherapy does not cure or control for that matter cancer. It causes cancer. If anybody says chemotherapy cures or controls cancer, I will ask, give one evidence. Only one evidence. And if you ask me to show the evidence, I have already given the evidence in your book, in that book, if you get in your hand. If you open the page, you will see there are thousands of evidences which shows clearly chemotherapy causes cancer. Radiation causes cancer. Surgery causes cancer. Right? Those evidence there with you. So, what happens? First, make a healthy person believe that you are a cancer patient. For that, you will do mammogram, biopsy, PET scan, and once you are convinced you are a cancer patient, even though there is no symptom, right? Even if there is a symptom, chemotherapy cannot be an answer because it will cause further problems. If you know any cancer patient, you will realize the moment before he gone to the doctor, he was quite well. Only when he started with biopsy, etc., the pain started, the discomfort started, the weakness started. Only when he went along with the conventional treatment, chemotherapy, etc., that is the time when the pain and discomfort is grown, and then he is in a trap. Try to recall the history of any of the acquaintances who you know. So if you think chemotherapy is an answer to the cancer cure or even a control or even improving the quality or the lifespan of a person, it is not like that. There is no evidence. Neither there is any evidence, neither you can say by experience. No, it is other way around. I have given all the evidences. Right? You come to our hospital, you will see the patients, how they heal. Now the final thing, the last 5 minutes, what we can do, how we can cure if there is a true cancer. How do we know it is a true cancer? The first thing is there is a tumorous growth, we know that. Cancer is spreading. Or there is extreme pain, there is extreme weakness, weakness, there is no cause. We are not able to see why there is a weakness. If there is no fever, or there is a fever which is not stopping for many months, many weeks. So, or the hemoglobin can be, or it may or may not be. But the idea is we have to see how we can reverse the symptom. What we can do so that his weakness goes away, so that his tumor stops and regress. What we can do, his fever goes away. What we can do so that he was losing weight, that stops and reverses. If we can do it, this means we have converted the rabbit into a tortoise again. If you want to get rid of the tortoise, it is not possible. It is possible only when you are killed or you are dead. Right? We all have cancer cells, you have to realize, you have to understand that, and it will be there in our body like a sleeping tortoise, and let it be. Need not to diagnose. The last 5 minutes, how we can cure.
Raghunandan sir to please come and talk about cold therapy. So, can you all put hands together and let us see what he has to tell to us. It's like cold laser therapy.
Namaste, Namaskar, Anban, good evening. All the doctors fraternity across the world, and especially I have been attending the session from the morning. I think we need the zeal and spirit now. So before I start the topic, first of all, give a louder applause to each one of you coming around the world, all the passionate leaders. Please give a loud applause. And secondly, since morning people are there, there are many seats are vacant, but those who are sitting here, they are more important for this World Congress. So let us respect each individual, each passionate healer, each doctor, because knowledge sharing is something, it's not a fast food where you go and get the coffee order, it's not like that. It is way that we need to have today the India is being celebrating the G20. What does it mean? Vasudhaiva Kutumbakam. Under the leadership of Prime Minister Modi ji, Atmanirbhar Bharat has started, Ayushman Bharat has started, and today Vasudhaiva Kutumbakam, the whole world is one family, the whole earth is one family, one future is there. Probably since morning I've been listening to all the passionate doctors, the speakers, the intellectual think tank, all the doctors. We wanted to integrate what? We are all human. Though we are doctors, whether we are allopathy or homeopathy or mixopathy, we are human beings. The diseases, what is in front of me, the patient, it can come to me also, my parents also, everyone. Unless we don't come together, understand as one family, we will not able to eradicate this pain or the miseries in the human world. Am I right? Dr. Rafiq is my big brother from Sri Lanka is there. See, most of my fraternity, especially from allopathy is also there, the professors are also there, leading the very good track record is there. Unless the audience, if you don't give me claps to them, their expertise all these years, I have been missing that claps, the happiness what we are, if you clap for the intelligence and think tank, tomorrow somebody will clap for me. Do you all accept it me? Please give a loud of applause to each one of you. Today since morning, those who have come here, those who have shared their knowledge, those who have shared their practice, we must take a leap out of them. Because any one person from this auditorium, if you carry the expertise and the good practice, good thoughts, good positivity, that is what Third World Congress. Maybe ups and downs, there is something is there, but I really, from the bottom of my heart, I will appreciate Dr. Deepak Rawat, Dr. Umakant Sharma, two people with available 10 rupees, they have done all these things. Wonderful things they have been created for all the fraternity doctors who come on. Once they see that, the Ayushman Bharat, it should come in my family, in others' family also, entire fraternity, doctors' fraternity, healthcare professional, we all should become one. Then only we can integrate ourselves. If the mind is not integrated, body-mind is not integrated, we cannot achieve anything. Do you all agree with me? So this is the thought what I expected since morning. Now, coming to the point, cold laser therapy is a alternative medicine. It's a laser physics. It's a part of science. What I speak is only a evidence-based therapy, what we have been practicing for the last 16 years. Cold laser therapy is nothing but low-level light therapy, photomedicine, photobiomodulation, and acupuncture is part of the cold laser therapy. If you ask me how, same point, acupuncture point, auricular point, you are all, whatever the practice you are doing, acupuncturist or acupuncturist, we are using only the cold laser. If you ask me, sir, laser is something which is harmful or which is affecting the body biology, no. See, the name cold laser means it does not give the cold effect, it is the soft waves. It is based on the sunshine hormone, what sunlight is giving to all of us. Vitamin D is the sunshine hormone. Everyone gets the free of cost from the sunlight. Do you all agree with me? Yes. But 12 o'clock when you go out, you will burn the skin. Correct? Sunburn is there, skin decoloring is there, pigmentation is there, especially ladies, they cover the SPF 40, whatever is there, they cover that. But we have taken the feel-good rays from the same sunlight based on the wavelength, 650 nanometers to 950 nanometers. This is the wavelength, very safest, very soft waves. You don't even get the pinch. You don't even get the feel on the skin. Only the rays, visible infrared and invisible rays, it goes inside the body. The holistic, what we have been celebrating, or what the World Congress is, complete body transformation. Physical health, mental health. The cold laser therapy does the same wonders, complete body transformation. Your physical health, your mental health. So that it will fix the chemical imbalance in the brain chemistry. Whatever the toxins are there, naturally it will eliminate. Then complete body, why do you get the diseases? When the immunity is being reduced, when your cells, the cold laser therapy works on the cellular level. I think Patak, you are not changing the slides? Yeah. So the cold laser, when you apply it on the body, it will become a chemical energy. When the chemical energy, it will stimulate the mitochondria in the each cells. If the cells are healthy, the complete natural repair system in the body automatically repair every pain. Probably trauma, accident injury, bone fracture, then surgery may required, may not required, internal medicine is required, hospital admission is required. For general occupational assault, repetitive strain injury, a engineer sitting in the chair for 8 years, or a clerk sitting in for the sedentary lifestyle, you are getting the cervical pain or lumbar pain, lumbar spondylitis or sciatica, it can be corrected back. Only thing is lifestyle modification is required, ergonomic posture correction is required. When the USP of the cold laser is there, when the cells are healthy, when the glucose of the enzyme is required to the cells and the cell proliferation becomes very faster way, the blood restoration is very, very fast head to toe. Any body biology, if the head to toe, if the blood circulation is channelized, you are getting a good sleep, good digestion, and you got a minimum that physical activity and no stress is there, you don't require any chemicals. Do you all agree with me? See, cold laser therapy is a very good USP. Especially, I have been treating the patient for the last 16 years. More than a lakh patient you have treated. The people those who are there, not only see, end of the day, what we speak or whatever we share the knowledge, our patient should get the progress. He should get the success. His smile on his face is our success. So whatever, sometimes I have seen that you need a diet therapy also, physiotherapy also, cold laser therapy also, internal medicine is also required. Do you all agree with me? So nobody can say that only I am the best. No. What the patient body is required, we have to have the open mindedness. When we all fraternity, doctor fraternity become a Vasudhaiva Kutumbakam, Sarve Jano Sukhino Bhavantu. When you have that process, then definitely patient will get faster research. If you don't have that open mindedness, probably we are not able to achieve the required result. Patient success is our success. And who is the best doctor in the world? The best doctor in the world is one who takes the patient.
Kulshetra, we request you to please come forward. We request all of you to please come from this side and you can get down. Please Kumar, please come forward. Miss Sunita Mishra, please come on to the stage. Congratulations.
Congratulations.
Miss Suman,
चलो अच्छा काम करते
Mr.
हैं
Madhu,
चल
Miss or Mrs. Reena, Miss or Mrs. Asha, Mr. Kuldeep Kumar, Miss or Divakar, Miss or Mrs. Thara,
चलो कांग्रेचुलेशन ये सोनी का भी आपको दे चार
Dr. Amit Arya, congratulations. So let's invite him onto the stage. आके इससे समझाइए वो बहुत it will be helpful for us. So we request you to please enter from this side and to exit from that. And next we invite Dr. Poonam. So next we invite Yogachari Sanjay Sharma ji to please come on to the stage. Alright, so I'm calling next set of awardees.
Congratulations, sir. ऐसे
Once again, we repeat, we request all the awardees to please enter from this side and exit from that side.
Thank you, sir. Congratulations. Thank you.
Next we have Mr. Manish Sharma, Pramod Kumar. Next we have Mrs. Chitra Sharma. Congrats. Next we have Miss
Congratulations.
Hi, Nisha. Next we call Mr. Lal Bihari Prajapati to please come on stage. Next we have Mr. Kanchan Chowdhury to please come on stage. Next,
Congratulations.
these awards
आगे
are
भी
going
कोविड
to
आगे तो कर.
Zainul Abedin, please come on stage. And next we have
Congratulations.
Mr. Prashant Kumar. That's great.
Congratulations आपको अभिनंदन.
Forgive me. Alright, next we have Miss or Mrs. or Mr. Honey. Please come on stage.
चलो खास किया रुकना भी है इसके बाद ठीक है ना. ट्रांसजेंडर रहते हुए भी कोविड के दौरान विशेष काम किए. कुछ लोगों के मन में आ रहा होगा इनको क्यों दे रहे हैं, समझ रहे हो. तो इनके लिए तो स्पेशल बधाई की बात रही है.
So can you all give a round of applause for all these awardees because they represent another gender in our society and we must respect them.
और ऊपर से प्रजापति लो. बाद में मिलना, सभी को संभाल लेना. किस एरिया में काम किया?
Alright, so
चलो इधर आ जाओ.
Mrs. Chandni and team to please come forward. We have 4-5 members here. The names are not clear, so we request you to please come forward. Mrs. Kanta Devi,
चलो
and we have Mr. Kashyap, Gopal Kashyap, and next we have Mr.
ठीक है, आगे भी करना है.
G.L. Agarwal. Sarita, congrats, we invite you onto the stage. And next we have Mr. Rampal Sharma to please come onto the stage. And next we call Miss or Mrs. Lata Thapa. Wow, what a wonderful name. Please come on stage. And next we have Miss Seema to please come on stage.
चलो कांग्रेचुलेशन.
Next, Miss Navani Sharma, please come on stage.
लगे ना. हाँ
विदाउट नेम है.
Navani Sharma, please come on stage.
ठीक है.
हमको ज्यादा टारगेट दे.
Please come on stage. Congratulations. Come forward. Next, Mr. Saurabh Dhar.